Hello, everybody, and welcome to Table Talk. My name is Joni Rampola, one of the registered licensed dietitians with Giant and Martin's. And today in Table Talk, we are talking all about the weight loss medications, which I'll just abbreviate GLP-1s, with one of our amazing pharmacists, Megan. And Megan, I will let you take a minute to introduce yourself.
Hi, everybody. I'm Megan Dixon. I'm one of the pharmacists with Giant Martin's Pharmacies. I practice in the state of Pennsylvania, and I've been with Giant for 5 years now, which is crazy to think about, but love it. And I'm so happy to be here working with Joni today.
And I'm so happy that you're sharing your expertise. So thank you again from all of us. So let's just kick off with a little explanation of what GLP-1 medications are and how they work for weight loss.
Absolutely. I'm sorry if you guys already know this or it's a repeat from our last talk, but a GLP-1 receptor agonist, or the full name is glucagon-like peptide 1 receptor agonist. They work by mimicking a naturally occurring hormone in our body, which is called GLP-1, and it's released in the gut after eating. So GLP-1 medications or GLP-1 receptor agonists work by slowing down emptying of the stomach, which makes you feel fuller longer and thereby decreases your appetite. Their primary function, though, is to assist the pancreas in producing insulin while also decreasing glucagon production. So not only is it making us feel fuller longer, but it's also helping with blood glucose or that sugar control in our body.
Excellent. Well, thank you. So what kind of weight loss results can people expect if they're taking a GLP-1 medication?
Absolutely. I think it varies per person, but per the American Academy of Family Physicians, patients on a GLP-1 typically see an average weight loss of 5 to 15% of their body weight over a 12-month period. So just to put those percentages into actual numbers, a person who's 200 pounds on average will lose anywhere from 10 to 30 pounds in the first 12 months of this medication. But I have a question for you, Joni, just because that's the average. Of course, yeah, that's the average of what a person loses. How can individuals maintain long-term successes and build sustainable habits alongside the medication that may increase their weight loss better?
Yeah, so long-term success is what everybody's shooting for, right? That's important. It's essential to adopt a balanced, nutrient-dense eating pattern. So GLP-1 medications, as you stated, they work by slowing down digestion, reducing appetite, and increasing feelings of that fullness. So as a result, people tend to eat a little bit less. So we need to ensure that that reduced food intake provides the essential nutrients that the body needs. Protein, just want to say your protein intake is really crucial. So inadequate protein intake can lead to muscle loss rather than fat loss. So prioritizing that lean protein sources such as chicken, fish, tofu, beans, or low-fat dairy can really help preserve that muscle mass while supporting fat loss. And then additionally, incorporating high fiber foods like vegetables, fruits, whole grains promotes that feeling of fullness or satiety. It supports your digestion and helps regulate blood sugar levels. And healthy fats are also important. But since most people eat less, smaller, more frequent meals that include both that protein and fiber to help meet nutritional needs is important. So combining dietary strategies with just general lifestyle, your physical activity, you're getting enough sleep, all that can support muscle retention, metabolic health, and long-term weight management success.
So it's definitely not just about taking the medication then, right?
It's not just about taking a medication. Yes, absolutely. A lot more in depth. So thank you for that. So beyond weight loss, GLP-1 medications have shown benefits like reducing the risk of cardiovascular events or Alzheimer's disease. Can you explain these additional benefits and what's the latest research in them?
Yeah, sure. So as Joni, in your question, you had said not only are GLP-1 medications great for weight loss and that blood sugar control in our patients' diabetes, but there are so many additional benefits that are coming out that have already come out. Research has shown things, but then more upcoming things are in the works too. So, as you mentioned, cardiovascular health is a big one. Studies have shown that GLP-1 receptor agonists can reduce the risk of a cardiovascular event. And when I say that, I mean a heart attack or stroke. So, this may be linked to lower blood pressure as a result of the weight loss, also lower cholesterol levels and reduced inflammation. Just, we're eating healthier, we have less weight on us, overall just creating a better atmosphere and a healthier heart. So A plus on reducing risk of heart attack and stroke. There's also been studies that show kidney protection. GLP-1 receptor agonists may help protect the kidneys from damage, specifically in patients with diabetes. But it can help protect kidneys in every patient that's using it because they help improve that blood sugar control and reduce what they call oxidative stress on our kidneys, which is what harms the kidneys. So better blood sugar control, less stress on the kidneys, healthier and happier kidneys. There have been some neurological benefits that research shows. So, research is currently suggesting that GLP-1 receptor agonists may have beneficial effects on the brain. So, they may reduce the risk of neurodegenerative diseases such as Alzheimer's and Parkinson's disease, and just improve overall cognitive function. Um, Additionally, I got two more bullet points on this one. Liver health is a big one. GLP-1 receptor agonists may improve liver function in people with non-alcoholic fatty liver disease. Again, just kind of like goes back to reduced inflammation in our bodies and also just less stress going on the liver in general. And last but not least, there's other things, like I said, in the pipeline and in the works for improvements and things being studied. But one of the biggest ones is reducing risks in certain types of cancers, which would be huge, and also improving bone health and reducing risk of some substance use disorders. So they're actually being studied in addictive behaviors as well. So it's it's kind of like a catch-all drug. It's one of those like really, there's so many different benefits. It's not about just losing weight and keeping your blood sugar under control, but there's also so many additional things that go with it that are super great with this drug.
Yep. So I have a lot of customer questions right now,
Yeah.
and I'm just going to start rolling. So I'm going to take the first customer question,
Go
and
ahead.
that is eating smaller meals more often when on one of these medications better for the individual? So eating smaller meals is important if you really don't have that appetite. So it makes you feel fuller longer. So sometimes it's harder to eat a big meal. So smaller meals can be helpful just to get the calories in, unless you feel like you can do it normally. Um, but that is that question. Then somebody's asking, and I'm turning it to you. What about type 1 diabetes?
So these aren't indicated for patients in blood sugar control with type 1 diabetes. And I'll explain that a little bit. It's just because one of the main functions is to assist the pancreas in producing insulin. And our patients that have type 1 diabetes, you're not producing insulin at all. So they don't work as great for blood sugar control, but that doesn't mean that they don't work for helping to lose weight loss because of that feeling fuller longer portion of it. So it's definitely something to talk to your doctor about or your provider about using for weight loss and not for your diabetes control. But great question.
Yep. So there's a couple questions about side effects. Can you talk about common side effects?
Absolutely. Most common side effect is upset stomach and nausea. That comes with it. Some people, can bear through it, and it should just be like during your adjustment phases that you get this, but that sometimes it lasts for everybody. So you definitely want to make sure that you're talking to your provider if it's like unlivable, and also working with a registered dietitian like Joni, to help make sure that you're getting all of the appropriate like nutrients, even if you're unable to eat as much as normal. Another big one is constipation as well. So you can get constipation or diarrhea with them, but I think more people will complain about constipation than not. Again, that contributes more to like the upset belly and upset stomach. But those are the biggest side effects. Is it's all down to upset stomach, nausea, and constipation.
And this is a great customer question. I love this one. How long do you continue using these medications?
Perfect. Yeah. GLP-1 agonists are something that I, as a pharmacist, would consider a lifelong drug. So they're intended for long-term use, especially for when you're using them for lowering your blood sugar, and all the other benefits that we discussed. But there have been studies that show when you stop them and you're using them for losing weight, I should say, if you're on them and you're using them for weight loss and you stop them, you can regain a huge portion of the weight back. So in my head, with all of the added benefits, it is something that we're on lifelong once we start, or intended to be on lifelong.
And a customer just kind of comment on that. They have a family member that just went off Zepbound, lost too much weight too soon, which to me, I think maybe they weren't on the right dose. But yeah, they're in their 20s. What do you suggest for them as their body adjusts back to normal eating when the noise comes back?
So that's a good question. It's really hard when you come off of a GLP-1 receptor agonist to not fall right back into your old eating habits or eating the same amount. So it would just be to follow if she's not working with a registered dietitian, my recommendation would be for her to work with a registered dietitian to help maintain whatever lifestyle or diet, whatever changes she had made while she was on the medication to continue and maintain her current weight loss, maybe not lose any more weight, but maintain where she's at until that food noise goes away.
Yep. Another customer question. Do any of these medications come in pill form? Are they generally covered under insurance?
For the most part, they do not come in pill form. There's one commercially available medication or GLP-1 receptor agonist that comes in pill form called Rybelsus. It is indicated for patients with type 2 diabetes. It's not one of the weight loss indications. And I will say, as an oral formulation, you have all the same side effects with not the same weight loss benefits. So the injectables are definitely better for weight loss than that oral medication is currently. For the insurance question, for the most part, I would say they are typically starting to become more and more covered under insurance. However, they're expensive medications, even for the pharmacies to buy, they're expensive medications. So, depending on your insurance coverage, you may have to have the doctor's office or your provider's office jump through some loopholes to get it covered, and you may have kind of a high copay, especially this time of the year when deductibles are still in play. Um, but there are lots of manufacturer coupons and like discount cards that if you have commercial insurance, they can kind of help reduce the price a little bit. Not everyone qualifies though and is eligible, but that's an option to help offset costs for you.
Yeah, there's a couple of comments about people that came off weight loss medication. So I want to see, I know you answered one
Yeah.
individual, but if we can talk more in general, what happens when somebody stops taking the medication? Is weight gain common for most people?
Yeah. Let me pull up my statistics. I just want to have all the right numbers for you guys. I did have this somewhere. Okay, here we go. So there's definitely some reasons why patients may discontinue or even be forced to stop the GLP-1. As one of the customers has said, the side effects are just too bad, or you lose the weight too fast. So not only are those side effects, they can be quite brutal on your body, but those drugs are also extremely costly. So as we had just discussed, not everybody can afford them long term. So some patients they just might not want to take it lifelong either. So the research has shown for many who stop taking the medication, patients do regain a substantial amount of that weight back. Because they've lost the help of the medication and helping them maintain their, satiety or that feeling of fullness. So the numbers are patients regain about 2/3 of that lost weight after 1 year without any other clinical intervention. So it's super important, again, if you are going to stop a GLP-1, to start working immediately with a registered dietitian, and try and think of other clinical interventions or watching your diet and helping with that physical activity as well. Um, just so if anybody is interested, the studies on that weight regain are included in it, what a trial called Step 1 and the Surmount 4 trial. So that's where those numbers come from on the 2/3 weight regain.
Is there a natural alternative to GLP-1 for someone who doesn't need to lose any weight but wants to stop feeling hungry every 2 hours?
I think that's a good question for you, Joni. I think you may know more about the more natural alternatives than I do.
Yeah, actually eating a well-balanced diet raises your natural level of GLP-1. It's that fiber and protein, and they are what raise it naturally. So eating a well-balanced diet can help. And then I would just say for somebody that's hungry all the time, I may look at their processed carbohydrate intake because when you eat white flour and sugar, it tends to make you hungrier than if you ate something that was more filling. So yes, I'm looking through all these questions
No, I
here.
love the questions.
Medicare, Medicaid, do they pay for it? Heavy sigh. There you go.
I know. So, Medicaid's definitely questionable. I think it's considered a brand name medication. So even on Medicaid, where you typically have very low copays, it'll be a little bit more than what you're expecting. But also the doctor, your doctor's office, your provider is going to have to do something called they call it a prior authorization, which is them appealing the insurance company and giving them a reason that you need to be on that medication. So that's going to be the most common thing that we run into with our Medicaid patients. So it's not that you can't get it, you just might have to go through a little bit more of a process. Um, and that process might be every 3 to 6 months. So it's not like it's a once and done. It's kind of continuous. For Medicare, I would say most Medicare Part D, as in drug plans. So Medicare Part D or Medicare Advantage plans that we see, most of them will cover GLP-1 receptor agonists, specifically for those with type 2 diabetes. But I have seen more and more of them covering the weight loss indicated medications as well. And again, if they don't right away, the doctor's office may just have to jump through those loopholes for you and fill out a little bit of extra paperwork and justify the reasons for needing them. But that's all.
Oh,
So,
thank you. So another customer question. Do people generally find the right medication right away, or do they have to bounce around to different medications for weight loss?
that's a great question, actually. If we're talking specifically about GLP-1 receptor agonists, I would say for the most part, what I see in the pharmacies is that you're on the one. You start it and you adjust the doses based on how you're feeling and how you're, taking those side effects. So they are a titrated medication. You start at a low dose, and when you feel comfortable enough, you go up a little higher. And then there's a top dose that you aim for, but you kind of stay within those doses of that medication, right? So if you're really not tolerating one, we can come off of it and try a different one. But for the most part, they all work very similarly and the side effects are the same.
Yeah, and I think the dose is part of tolerance too. Some people get started on too high of a dose. It's better to start really low. Is that correct?
Yes, absolutely. And I can't even say like everyone, all of the drugs have their own doses, which makes it so much more confusing for everybody. But all of them have a very, very low starting dose. And then they have typically like almost 3 to 5 doses in between that you can go up to before you get that max dose. So it's very important to start low and go slow is like the best thing that I can say about them. Start low, go slow, and take your time increasing. It's not all about super fast weight loss. Like we want to do it healthily and we want to make those lifestyle changes as well as we're going through. The medication is just there to help you. It's not there to do the work for you.
Correct. And I'm just saying, from my perspective, going slow actually preserves muscle mass. When you go too fast losing weight, you lose muscle and fat. So it's helpful that way as well. So, Megan, what might someone do if they're interested in trying a GLP-1 medication?
So really the thing is you want to talk to your provider. You want to talk to your doctor. Um, I was just trying to find my notes here, but you want to make sure you talk to your provider. Most patients can start a GLP-1, no problem. Um, there are some patients who it's not technically appropriate in or not fully appropriate in, or they may want you to try other options before jumping on the GLP-1 bandwagon. So definitely talk to your provider, whether it's a doctor, nurse practitioner, whoever your primary care provider is, please talk to them. Um, there's a lot of stuff out there right now with ads online and stuff like that. So the best thing that I recommend is discussing with your doctor, so they can, make sure that one, you're the right patient for the medication and pick the right medication for you.
Yeah, so I want to ask your opinion of that because you mentioned the ads, and I know I've seen a lot of ads for this type of medication without a prescription from a doctor. What are your thoughts on like these virtual telehealth services that can dispense medications?
This one's tough. I think everyone's going to have their own opinion on it. But as a provider, I just feel there's so many websites advertising GLP-1 receptor agonists right now. Um, and again, my opinion is that the sites are often very misleading and provide inaccurate information. So there's a lot that goes into starting a GLP-1 receptor agonist, including like we had already talked about those titrated doses. You're going to have a lot of appointments at first with your provider to make sure you're tolerating and that things are happening the way that they're supposed to. We want you to meet with a registered dietitian. And I think it's really important to ensure that you're being monitored appropriately while taking these medications and have the full support that you need. As Joni had pointed out, like there's a risk of loss of muscle mass. You can lose too much weight too fast. There's a whole bunch of things that go into it. So I really think people need to be monitored closely, and they lose that when you're going on these online sites and just paying for a prescription to be sent in. Unfortunately, adding a medication to your cart online and checking out may not always ensure that you have the full support that you may need while taking the medication. In addition to support, there are a lot of compounded formulations of these medications. And when I say the compounded formulation, I mean like that's made not a commercial product. It's not Mounjaro, Wegovy, or Ozempic. Like it's not brand name. It's made in a pharmacy elsewhere, and they typically are made in doses that aren't studied. And they're being created and compounded in a pharmacy. So they're not being regulated as stringently or strictly by the FDA as the commercialized products are. And you don't really know where they're coming from. So that is my tidbit is avoid the ads, talk to your doctor.
Yeah, good point. So thank you for that. And then a customer is asking you saying like should be monitored. Like does monitoring include blood work?
It may. I think if you're obviously using it for more blood sugar control, you may have a little bit more blood work. Um, but I would say if you're taking a GLP-1, the doctor may want to get blood work after 6 months, or just with your yearly blood work, they may add in a couple extra things just to make sure that you don't have any like nutrient loss and that you're not missing any of the appropriate vitamins. But have you seen with your patients, Joni, have you seen any like additional blood work? Do they talk about that at all?
Not necessarily, no.
That's how I am too.
Yep. So in general, are these medications covered by insurance and how accessible are they for most people?
Yeah. I know we already touched on this, but coverage of these medications does vary depending on the specific health insurance plan and also the indication for use. There's two chunks of them right now. There's those that are indicated for the patients with type 2 diabetes and those that are indicated for weight loss. So for those using a GLP-1 agonist for type 2 diabetes, most health insurance plans, including Medicare Part D, will cover one of the many medications that are out there right now as a GLP-1. Coverage for GLP-1s for weight management is just a little bit more variable. Some plans may require that thing called a prior authorization, where your provider's office just has to justify the reasoning for why you qualify for the medication. Some plans may cover the medication if the patient has a body mass index or a BMI of 30 or higher, and they have other qualifying conditions. So it may be like a full package deal. You may need to be overweight and have something else going on in order to get it covered, but it really just depends on the insurance. And I know I had said it earlier, but even with the coverage, these medications can be a little pricey. So most of the manufacturers do offer like a coupon to help bring down the costs for you. You and your provider or your pharmacist should be able to show you where to register for these manufacturer discounts, depending on your eligibility as well. Um, and not only insurance, but there's been availability issues at pharmacies themselves, right? So I would say, even compared to our last talk in January, these medications are widely available at most pharmacies now. There was a time where they were impossible to get. However, they are easily available for pharmacies to order as needed. Most pharmacies will limit patients to a month supply just to try and manage waste since the doses can change so frequently.
Yep. Okay. So I'm going to go through some customer questions.
Perfect.
So somebody had cataract surgery and was told to stop Ozempic at least a week before surgery. Is this because it affects your vision or is there another reason?
It can affect your vision. There's like a very rare side effect that it can increase ocular pressure in your eye. So it's just one of those like your eye surgeon was probably being extra precautious just to avoid any rare instances from occurring. They just have you delay it for an extra week or two in order for you to have that surgery and then recover from that surgery after. More of
And
a
that,
precaution.
thank you. Yes, that person is concerned about their eyes. So just wanted to hear your eye
Yes.
opinion. Does it help to take prebiotics or probiotics on these medications? And how about taking them when not on these meds for weight loss?
Prebiotics and probiotics. I don't know that they necessarily will help reduce the side effects, but I think they're great for overall gut health if it's something that you regularly take and want to. Um, I think Joni, you would better be able maybe a little bit on gut health with probiotics. I'm not sure how many of your patients take them if they had reduced side effects from them or not, but I think that the side effects are mainly from that feeling of fullness more so than gut health.
Yep, but I feel like probiotics help with weight loss in general. So it's
They're
always
great.
yeah, a good thing if you tolerate them. Um, so a customer says, am I the only one who thinks being on this drug for the rest of your life is too much? If it's being used for weight loss, wouldn't it make sense to help wean to normal eating habits once the ideal weight is achieved?
That's a great question. Um, and I think that's one of the things being studied. So the trials I had talked about earlier were mainly for patients that were kind of stopping at cold turkey. So if you stop at cold turkey and you fall back into like that, if you don't have that fullness to help you eat less and things like that, you're at higher risk to gain 2/3 of that weight back. So I think weaning off is what some studies are currently looking at. Like, does that help? Because you're coming slowly off of it. So you can train your body what to eat and how much to eat without having that drug to help you. Again, with all of the other benefits of it, I think it's a great drug to stay on regardless. Like you're having cardiovascular benefits, you're having cognitive benefits, like we're going to help your heart, your brain, your liver. Like, so if you don't want to take it lifelong, I think there are options to try and wean. And some people are doing that, and that's great. But for me, the benefits outweigh that decision. So as a practitioner, I like it as a lifelong drug.
And I just want to give a little analogy too. Like we take blood pressure medication or medication for diabetes. So if your blood pressure becomes normal on a medication, or if your blood sugar becomes normal on a medication, you don't say, oh, well, let me just stop the medication now because I got to the goal I wanted. Like you need to keep taking it to keep that goal alive, if that makes sense.
Yeah, and that's a great point, Joni. It's one of those medications that you you may at some point you may stop feeling the benefits, but the benefits are still there. And conversely to your blood pressure medication or cholesterol medication that you take every day, this is once a week. So once a week injection, really quick. It's not an everyday thing, which is nice.
Yep. So last question for you. What advice would you give to people who are considering a GLP-1 medication but are hesitant or unsure?
Best advice, which this group is very good at, but best advice I have is ask all of the questions. Ask them. I think there's so many benefits to this medication. It doesn't hurt to try them. If you do not tolerate them well for whatever reason, from the side effects we talked about, you can stop and we can go back to the drawing board with your provider for other weight loss ideas. But you don't know how well they could work for you if you don't give them a try. So ask the questions and don't be afraid to give it a shot.
Absolutely. Well, thank you so much for joining us, Megan, and giving us all this great information here. You could see, like from the chat, everybody was really engaged and appreciated it. And we love hearing from you.
Yes,
Thank you
thank
so
you
much,
for having me,
everybody,
guys.
for
It was
joining us.
great. And take care.
Yes. Have a good day, everybody. Bye.